you are here today for your left hip today.
Left hip.
Left hip. I am going to borrow your right wrist. Thank you. And then this is the best part. So after surgery, before we get you up and walking, they're going to have you eat lunch first. So if you want to pick a sandwich here that looks good, and after surgery, the doctor is going to give you a call to let you know how it all went. And then about 45 minutes to an hour and a half after that, the nurses will call you when they're ready for you. They'll have him come back so you guys can do physical therapy together and like discharge instructions. So you'll be here for that part of the afternoon.
I've had really great communication with this office.
Susan, hey there. Good morning. How you doing?
I'm ready for prime time.
All right. You'll be in the operating room about an hour and a half for the whole surgery, positioning and everything. Obviously, you'll wake up with a brand new hip and all the parts will be solid, so you'll be able to start walking and put weight on it right away.
Amazing.
You'll be over in the recovery room for several hours afterwards and get physical therapy, get a light meal and all that.
The communication of this entire group has been fantastic, so I don't have any questions.
Good, perfect. And who should I talk to afterwards when I finish?
My husband, Bob.
Bob, okay, great. Is he going to be here or should I just call him?
Call him.
Okay, great. I will call him. He's the one coming to get you later? Okay. She had a spinal anesthetic, so is totally numb from the waist down, but is sedated as well during surgery. She'll slowly wake up from that, but won't feel anything for another, half an hour or so from the spinal. So obviously she can't walk, but we'll wheel her over to the recovery room. She'll stay there for a couple of hours. She'll get a light meal. She'll actually, once the legs are awake enough, we'll get her up out of bed. She'll use a walker and take her first few steps on the brand new hip. So it's pretty exciting. We'll have a physical therapist work with her after that. She'll learn how to climb some stairs even. And then once she's feeling really safe and we're all feeling safe that she's safely getting around and she's comfortable and everybody's comfortable she's ready to go through some discharge instructions and she'll go home. Hi Bob, it's Dr. Denes calling about Susan. We just finished up with her hip replacement. She did great. Everything went very smoothly, no complications with surgery.
I'm moving.
Nice.
Yeah.
Keep moving and grooving.
Everything. Yeah, it's wearing off and I don't have the heavier effects of heavier anesthesia. So, and my sense of humor has returned.
My name's Corey. I'm a physical therapist, and we're going to go strolling. How's that sound?
Okay, yeah.
Perfect. In the next 24 hours, when you're at home and you get up to go to the bathroom, just have somebody go with you.
Okay.
If you're going to get dizzy and lightheaded, it's usually at 3 o'clock in the morning when you're using the restroom. That's just for tonight and maybe first thing tomorrow morning. Okay. We also tell everybody that today, kind of replenish the system today. Get home, I want you to snack. I want you to eat your favorite snack, whatever that is. Emphasis on proteins a little bit. Make sure you have a good dinner. Make sure you're hydrating well. Get out of bed really slowly here. You're going to probably do that anyways because you're going to be sore. But if in the middle of the night you have to go to the restroom, make sure you take your time. So your emphasis should just be on walking perfect. That's your goal. People use a walker for 3 days, maybe a week. Okay, and then oftentimes they'll use a walking stick or cane on the opposite hand for a week, maybe after that, just until you're walking perfect without a limp. It's better to use something and get rid of that limp. So now I'm going to have you just march in place a little. Remember, push on your hand. Yeah, when you're on the left leg. Nice. There you go. Good. Oh, you're not going to use it very long at all. Yeah, you're looking fantastic.
Here you are.
Chariot.
Your chariot awaits.
The new and improved. Appreciate it.
You're welcome.